Hello friends, today I will be discussing a very important topic which is of great interest as well as concern for all of us, and that is recent increase in the incidence of heart attacks and cardiac arrest, especially in younger population. And when we discuss this, one thing which is very obvious is that there has been an increase in the incidence, there is no doubt, but we also need to know what is causing this increase in the incidence of heart attacks. And recently it came in the news because of increased incidence of heart attacks in one of the districts of Karnataka, and the Karnataka government set up an expert committee to investigate the underlying causes. So mainly it looked at a few things. One is the effect of COVID vaccine, the effect of COVID infection per se, and any other risk factors. So what was clearly shown is that COVID vaccine is not linked to any case of cardiac arrest or heart attack at this stage. So because the impact of COVID vaccine is only in the initial few weeks after the vaccination, and most of the Indians received vaccine in 2021. So in 2025 we do not expect any effect of the COVID vaccine now. And also if you look at the one risk called myocarditis where inflammation of the heart muscles happen, so that is mainly seen with mRNA vaccines, and in India that vaccine was not used. So in conclusion, COVID vaccine is not responsible for any case of cardiac arrest or heart attack which is happening now in Karnataka or any other parts of the country. The second fear was whether COVID infection per se has led to an increase in the heart attack and cardiac arrest. So definitely COVID infection is one of the conditions where it increases the blood coagulability and clotting tendencies, and we had seen many cases of heart attacks as well as strokes and thrombosis in other parts of the body in the COVID pandemic period. And as per certain studies, the increased tendency to clotting, it persisted for up to 1 year. So even if we look at, COVID pandemic is at least about 3 years away, and from the last major surge in the COVID cases. So COVID infection also should not lead to increase in the heart attack and cardiac arrest now. So, and regarding the vaccine, one more thing was pointed out is that COVID vaccine prevented COVID infection, and as a result, it had a beneficial effect in reducing the risk of heart attacks. So, summarizing those 2 points, the heart attacks and cardiac arrest which are happening in younger population or anyone today in India are not related to either COVID vaccine or COVID infection. So then the expert committee also looked at what could be increasing, what could be leading to increase in the cases of cardiac arrest and heart attack. So they were mainly the traditional risk factors. So when we say traditional risk factors, they were always there and they are there today also, but the incidence of those risk factors have gone up. For example, what they found is that smoking or tobacco was involved in almost half the cases. So that is definitely a big number, and smoking has gone up in men as well as women, and something connected with smoking is also air pollution, and many research papers have shown that air pollution is a risk factor for stroke as well as heart attack. And most of the Indian cities now, unfortunately, they are heavily polluted, so that is another factor which could be fueling the increase in the risk of heart attacks. Other traditional risk factors that were noted is diabetes, high blood pressure, obesity, sedentary lifestyle. Now, many times we also see patients with heart attack and strokes in our OPDs and emergencies, and even though they are not known to have any risk factors, but when we investigate, we find that they have elevated triglycerides, elevated LDL cholesterol, HbA1c, which should be normally below 5.7, it is either in pre-diabetic range or even diabetic, which were not known earlier. Even if you look at obesity, so waist circumference is higher, abdominal, they are obese or overweight. So these things are known, but many people do not pay attention. And then sometimes it is shown that those who are running or doing a workout, they have a cardiac arrest or heart attack. So that has led to it, but most often that is not the case, because both running or any other aerobic activity as well as strength training in gym or gym workouts, they are all beneficial for health. Overall, they reduce the risk of heart attack as well as strokes. Only in extremes of cases, if somebody is overdoing it or exceeding the limits, then that can be a risk factor. But if you are doing within reasonable limits, what is prescribed, so for aerobic activity, it is 300 minutes of moderate activity exercise in a week, or 150 minutes of vigorous activity like running in a week. So if you are within that limits and even little beyond that, they are quite safe. And strength training also, if you can do say 30 to 45 minutes of sessions 2 or 3 times in a week, again it is within safe limits. So if somebody is doing say 2 hours every day, and then so it comes to almost 14 to 15 hours in a week, that is like overdoing it. That much is not needed and can be detrimental also. And then sleep deprivation. So today, many youngsters, they do not sleep adequately, which is supposed to be 7 to 9 hours. So sleep deprivation is a risk factor for heart attack and strokes. And along with that, something similar is stress. So when I meet youngsters, very few youngsters say that they are stress free or they are relaxed and happy. And stress, overworking, we have heard about 70-hour work week. So, if somebody works more than say 45 to 50 hours in a week, that is overworking, and in research it has been shown that overworking does increase the risk of heart attack and strokes. And we have had few cases which were highlighted where people have reported excess work and very tough deadlines to complete, and they have suffered from heart attack and strokes. And add to that genetic risk factors, so that is something we cannot modify. So if somebody has a family history and even if they are totally healthy, they are at a higher risk, and there are few blood tests we can do for that, that is called as lipoprotein A, and if it is elevated it could indicate that genetic risk factors are there, so that person can take more precautions. So when we come to precautions, what can one do to reduce the risk of heart attack at young age or any age? So number one is that to avoid being sedentary, so regular physical activity is a must. So I already mentioned the prescribed limits, and also during different times of the day, try to be mobile. So after meals, walk for 5 to 10 minutes. That is very important. And then instead of using elevators or lifts, try to use stairs. For short distances, try to walk rather than take any vehicle. So mobility is one thing which is very useful. Along with that, some amount of strength training should be done. And then the diet, if we see today's diet, it is mainly carbohydrate rich, fried foods, junk foods, sugary drinks, uh, alcohol. So these are all detrimental for health, and we know that, all of us know that. So we have to minimize the consumption of sugar and this refined food, fried foods, and carbohydrates, excess carbohydrate, and have optimum amount of protein in the diet. And then other thing is sleep. I already mentioned 7 to 9 hours of sleep. Try to manage stress. Don't try to avoid overworking, and then have regular screening so that we keep checking our HbA1c. Look for, even before HbA1c starts going up, there is something called insulin resistance, which we can measure with the help of triglyceride and HDL. So triglyceride to HDL ratio, if it is 1, that is ideal. More than 2 means already you are going into insulin resistance. And we can also check fasting serum insulin and blood glucose and calculate something called as HOMA insulin resistance. So if you are already insulin resistant, then we have to start focusing on the diet, reduce the carbohydrate, and do regular exercises. So that can prevent you from becoming pre-diabetic, because insulin resistance, pre-diabetes, and diabetes, all three are risk factors for heart attack. It is not that one has to be diabetic to get the heart attacks. And then also check your lipid profile, serum homocysteine. So there are a few other tests which you can discuss with your doctor, and should be done on a regular basis, so that the risk factors can be identified early and treated, so that we can prevent the heart attacks.